Welcome back. Just past the bottom of the hour. Measles cases hit a 35-year high in the United States, and it's only July. The vast majority of cases stem from domestic outbreaks fueled by low rates of vaccination. Measles, you might recall, was declared eliminated in the U.S. back in 2000, meaning there was no ongoing transmission among people within the nation. It's not the case anymore. As of last week, the country has 2,318 cases, which surpasses our 2025 record. So international health officials will meet in November to determine if the United States and Mexico will get to keep their measles-free status. Joining us now, senior national correspondent at The Bulwark, Jonathan Cohn, and former director of the National Center for Immunization and Respiratory Diseases at the CDC, Dr. Dimitri Daskalakis. Thank you both very much for being with us. Doctor, I'll start with you. This is not just sobering statistics, I'd argue downright depressing and infuriating statistics. How did we get here?
So I think it's been a long course. So to be clear, I think we've been seeing decreasing immunization rates in the country for a while. But what we are seeing is the United States is in the context of a large global increase in measles, and our immune barrier, which is vaccine, if that starts to wane, if people aren't getting vaccinated, we don't have the protection that we need to prevent outbreaks from going from small outbreaks to large. And so I think that's what we're seeing in the numbers. We're seeing close-knit communities where immunization rates are low. Someone comes from another part of the world or maybe another part of the country now, and it's like a spark to kindling if you have unvaccinated people. If there's 10 unvaccinated people who are exposed to measles, 9 will get it. It's the most contagious virus that we know. And so we're seeing the effect of low vaccination rate. It's like the canary in the coal mine. Measles is the one that shows you where the problems are because it's so infectious. And so I think this actually also predicts some bad news for other vaccine preventable diseases in the future.
Yeah, both deeply worrisome warning there, to be sure. And Doctor, what would it mean, in fact, if we were to lose our measles-free status beyond becoming a national humiliation?
Yeah, I mean, I think what it really means is that an infection that we had committed to eliminating in the country has now become nearly what we call endemic, which means that there's transmission on American soil. And that is a giant step backwards in public health. And so I think what it means is the more measles there is, the more cases there are, the more likely there will be complications, severe ones like brain swelling, pneumonia, and sometimes death, but also other complications like people's immune systems experiencing what they call immune amnesia, because measles makes your immune system dysfunctional for weeks or months after the infection. And so what it means is more people will get measles. Children will be out of school, parents will miss work, and some of those children will get sick and potentially need to go to the hospital or worse.
Jonathan, talk to us about the role that RFK Jr. has played in all this.
Yeah, well, I think he bears a significant responsibility for this situation in two respects. So Dimitri was just saying we have been seeing this decline in immunization rates for some time. And obviously, there's a lot of reasons for that, but a big factor in it is all the misinformation out there. And Kennedy has been, for 5, 10, 20 years going back, one of the primary sources of that misinformation. So even before he got into the government, he played a role in these falling vaccination rates that have made us vulnerable to measles in exactly the way that Dimitri just described. But then, of course, now he's at HHS. He's running HHS. And remember, he came in, he told us, he said, we're going to give infectious disease a break. It's not going to be a focus. He has not made it a focus. But even worse than that, he is continuing to spread that misinformation. If you go to the CDC website, I checked again a half hour ago before we came on to make sure it was still the case. There is a statement there that says, on the statement, that there may, and it says, science has not disproven the link between autism and vaccines. That says that health authorities and health scientists have ignored studies about this. these are not true statements, but they are still up on the CDC website. People see that, they become confused, and it fuels this hesitancy about vaccination. And, most people are still going to listen to their doctors. Most people know to take vaccines, but you go from 98% to 90% or 85%, and that's when you get these kinds of outbreaks.
Yeah, and that makes a real difference. Thank you for underscoring that. And also, Jonathan, staying with you, the vaccines is just one part of just this mixed messaging, confused messaging, muddled messaging that we've gotten from the health department, from the CDC, in the Trump administration, which includes the cyclosporia outbreak that parts of the country are dealing with now. It just feels like the federal government, if not perfect, but was the gold standard in terms of this sort of being reliable on issues like this. Now it feels like people don't know what to believe or trust.
It's tragic. It did not have to happen. We've spent decades building up institutions like the FDA, like the CDC, to be these paragons of trust. And look, and sometimes they're going to make mistakes, and sometimes people are going to have doubts. And we saw that during the pandemic. It's the nature of things. But, around the world, our institutions were revered for being scientifically rigorous, and you knew that the best possible judgments were being made by scientists using the best possible evidence. And now people, you can't trust that anymore. And that is not something we're going to be able to repair quickly. It takes decades to build that up. It takes, as I think we're seeing now, a few months, a few years to tear it all down.
And doctor, what can be done to repair this? What sort of work can be put in to fix this?
Yeah. So I think probably the most important thing is that, parents, people should consider the source of their information. So I think that the short-term answer is, don't listen to politicians, listen to your clinician, listen to your care provider, your physician, your nurse practitioner, who's ever taking care of you and your family, because they're going to give you the information that is actually guiding you to make sure that you preserve the health of your family, your children, and prevent these vaccine preventable diseases. I think trust takes a long time to build and an even longer time to earn. And so I think that we are looking, as Jonathan said, to what will take potentially years, if not decades, to be able to regain the trust. These organizations have worked so hard to build and maintain trust. And as he said, it just takes a few months to really destroy it. And so I think we have a real uphill battle. But, consider your source, listen to your clinician, listen to your doctor, because they're going to give you the best recommendation that makes the most sense for you and your family.
Dr. Dimitri Daskalakis and Jonathan Cohn, thank you very much. This is a really important conversation. We appreciate it.